Good afternoon, ladies and gentlemen, all protocol observed. Thank you so much for having me at this meeting. I'm Ralefa, a clinical oncologist by profession, and today I'll just give a brief overview of oncology in Botswana. Oncology is a branch of medicine that deals with diagnosis and treatment of cancer. And cancer itself is a group of diseases with uncontrolled cell growth, with potential to invade or spread to other organs. The cancer burden is increasing globally. And what we see is that there's a disproportionate burden in low middle income countries, including sub-Saharan Africa, where we find ourselves. Low middle income countries are expected to see quite a high increase in the new cases of cancer patients, with about 80% expected between the years 2008 to 2030. If you look at this, it's actually double the rate of what is seen in high income countries. The WHO has projected that 10 and 11 million cancers will be diagnosed each year in low and middle income countries by 2030. We've done so much at this point in time to deal with infectious diseases, but what we now see is that non-communicable diseases are even on the rise, and actually cancer deaths are said to exceed deaths from malaria, TB, and HIV combined. What could be some of the challenges, the reasons for some of these things that we're seeing? It could be limited resources. There may not be enough resources to offer good prevention, screening methods, for instance, or there is lack of human capital, lack of infrastructure in low middle income countries, for instance. There might be cultural perceptions, essentially meaning that some people may not even believe there's cancer in the first place, or if they're offered treatment, they may not be able to complete the treatment, or at some point in time, they may not be able to pick up the symptoms and signs earlier. Sometimes you may see that patients will present late for treatment. So it may be that even if some people may have enough infrastructure, for instance, to be able to treat these people, but because of late presentation, mortality is still high. This has definitely then made the fight against cancer to become a global effort to reduce disease burden, promote equity, as well as ensure cancer care is a priority globally. What about what's happening back home here in Botswana? Oncology is a fairly new discipline, probably started around the 2000s, but we've seen some growth over time. Whereas in the time past, we used to refer most of our patients to our neighboring countries, at the moment we're able to offer quite a lot of services in the country, both in the public sector and in the private sector. Currently in the public sector, we've got access to medical oncology as well as surgical oncology services. We find that we have radiotherapy, medical oncology, surgical, as well as nuclear medicine available in the private sector, among others. We're seeing about 2,000 new cases per year as it is. And what the statistics show is that as far as men are concerned, most of our patients who present with prostate cancer, and as far as women are concerned, most of them will present with cervical cancer as well as breast cancer. This is statistics from the Global Cancer Incidences Botswana 2020 statistics. We're currently also updating our National Cancer Registry. What then have we done to address some of this? I mean, we've formed some strategic partnerships and essentially looking at ways to develop and implement a comprehensive cancer care program. What the country has done at the moment is that it's done a comprehensive needs assessment. So we get a baseline as to where we are at along the continuum of cancer care. Now, using this, we would be developing interventions to interrupt the narrative at each stage. It is good to actually manage cancer patients in such a program so that we can have good use of limited resources in our setting. Some of the partners we have are the WHO, the IA, some institutions of higher learning in and outside the country, some NGOs, for example, and there's quite a few other things we've done with them. I mean, there's been some trainings that have been offered. There has also been projects which have been developed and specifically looking at setting up radiotherapy and nuclear medicine services in the public sector. In all of these things, our thoughts are always that there's a patient or a potential patient that we need to think about, hence the need to have partners both internationally and in the country. Now, one might say, well, then how do we manage cancer? Why is it important for us here as a team that has attended this workshop to even hear about cancer patients in the country? Well, we always say that management of this patient is never a one-man show. Of course, it's multimodality team, multidisciplinary team approach, which always centers everything around the patient first. And of course, after that, we look at the community because this is where the patient is coming from and how they do affects what happens in their respective cases. Now, we also look again and say to manage these patients who need some medical people. Of course, there has to be people who will be able to diagnose, for instance, treat the patients, know what to do with them if they have any side effects to any of the treatments, or even be able to assist them in such a way that they may never even develop a cancer in the first place. We also need people like engineers. Somebody was saying to me, oh, but why engineers? And the first thing that came to my mind was, okay, think about it. For instance, as a clinical oncologist, it means that I also do radiotherapy. What it means is there's somebody who has to develop some form of machine for me to be able to treat my patient, for instance. And then again, we also know that, yeah, we always hear we're giving our patients some chemotherapy, or sometimes we're giving them some what we call some targeted therapy. And then there are also biologists in places, chemists in places, even in the medical field, who look at all this cancer development pathways and can actually develop drugs that can stop disease from growing. So this clearly then shows us that we all need to come together and join the fight against cancer, because it is definitely quite possible to do that. Now, this is just a slide to show that there is quite a lot happening, yes, internationally. And what we're looking at is that globally, in every setting, we don't want to see any cancer patient not being able to receive treatment. We don't want to see any person developing a cancer in the first place, which could have been prevented. And we also don't want to have any other person who is not able to get treatment because maybe they don't even have the money to be able to spend on some of this medication or some of these treatments that we offer. So the slide here is just from UICC, and the work that they're doing is essentially just to promote and encourage leadership growth globally to fight cancer. Thank you so much.